Who is responsible for issuing of measures to stop transmission of COVID under the Pandemic Act? And who is responsible for the enforcement of those measures? We've seen, Mr. Speaker, we've seen measures coming out by way of papers, but the enforcement part of it were lacking. And I want to know from the Minister, at the provincial level and district level, who is responsible for the enforcement of protocols and measures of COVID-19 in the country? Because I see none in my province. Are those measures properly enforced, or is it centralized in Waigani? My second question, is there any insurance for the frontliners? Does this government have any insurance for the frontliners, that is the health workers who are handling the patients, COVID patients, as well as handling the dead bodies, and the police on the ground enforcing the measures? Because we lost 3 health workers, Mr. Speaker, and 2 police officers in the province. Number 3 question. Is there any funding available for the rollout of vaccines? If yes, who is responsible for the release of those funds to support the province? If no funding for rollout of vaccines, is there any strategies in place to roll out the vaccines? Because I know there's a lot of challenges we will face as we want to roll out vaccines in the country. What are the strategies? My last question. Given the situation in Goroka, the provincial controller has put the measures in place, and to put forward the police as well as the doctors to carry out, doctors or the health workers to carry out those measures, there is a shortage of funds. The provincial government provides only 1.4 million, but we will need more than that to be rolled out in the province. Do you have any plans for Eastern Islands Province? Lastly, Mr. Speaker, I have signed a provincial plan in the month of August for COVID plan and presented to the NDOH for the minister to take it up. I don't know the status of the plans and the fundings that is requested for us to prepare. Can you give us account of the latest update on the provincial COVID plan that we gave the month of August? Before I sit down, Mr. Speaker, we have leadership problem in the Provincial Health Authority, and I've been asking about this issue on the chairman of the Provincial Health Authority and the illegal directors of the Provincial Health Authority. And it's quite 1.5 years now. I've brought this issue up many times. Many recommendations has been asked, and I've given many recommendations. To this date, I don't know the status. We're lacking leadership or authority in the Provincial Health Authority. Can you give us the update on the replacement of the chairman of the Eastern Islands Provincial Health Authority? Thank you, Mr. Speaker.
Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the good Governor of Eastern Highlands Province for his questions. Before I go into his questions, on behalf of our government and our people, I want to send my deepest condolences to the victims of the COVID-19 in all provinces, especially in Eastern Highlands provinces where it's been hit really hard. Number one, the first question about the measures. The measures formulated through a committee at the NCC, which includes MISAC, which is our brother scientists and our policy people, and then it's brought to the controller of the pandemic, the Commissioner of Police, and he signs off on it. And then it's sent to the provincial controller to implement the measures within the province. And they have to partner with the Eastern Britain, with the provincial governments to ensure that the measures are adhered to. There is a search team that's going into Eastern Highlands to help with the COVID. This COVID Delta variant, as I said before, there's no cure for it. And one of the things that we have to realize is we need time. It needs time to get out of your system. It takes about 14 days to 21 days. And this is from our leading experts. It won't happen overnight. So we need people to isolate themselves. We need people to, if they need oxygen, we provide the oxygen and that. But the gist of it all is, in this whole world, we do not have a cure for the COVID. As I said, it's about time. One of the questions, question number 3, the vaccination rollout is being funded by our government as well as our foreign partners. In the last 2 weeks, the vaccine rollout has quadrupled in numbers. So a lot of our people now seeing the importance of being vaccinated are turning up at vaccination points to get vaccinated. This is one of the things that will help slow down the variant of the virus from moving and putting people into hospitals is the vaccine. This has been proven overseas that the vaccine has provided some safety for people that have underlying issues or people that are of old age. And Mr. Speaker, we can tell from our numbers that a lot of people that are vaccinated are being saved from going into the hospitals. Yes, we may have 1 or 2, but not everybody's DNA is the same. We all have different DNAs, and medicine affects all different types of people. Even the same, someone could be allergic to amoxicillin. It could cause us a lot of problems. So, as I said as an example, not everybody has the same DNA, and we cannot ensure that the vaccine will work for everybody. With the funding through to the provinces, up to date now, the government has given the grants to PHAs, but in this time where emergency is really at what we really need at this point of time, I had a meeting with the Treasury last week, and they are ensuring that funds will be sent to the provinces.